on our video, we're going to introduce Sister Anastasia, and she is going to talk about the maternity waiting home in Mwanbani, Tanzania, where we want to partner with her. They have a hospital there that the sisters run, and they've donated land to our organization so we can be partners with them. So this is what we're trying to raise money for, and this video explains from their point of view with their priest, their pastor, exactly what we're trying to do. Thank you.
I am belong of the congregation of Our Lady Queen of Apostles of Mbeya. I am working at Mwanbani Hospital as accountant. The hospital has administrative team as follows: Father Gilbert Sanga as a medical officer in charge, Health Secretary Mr. John Carroll, Human Resource Mr. Francis Mwarugana, Matron Sister Veronica Kayeta. Both are here to join us in our discussion today. The one who is going to explain our project about maternity ward is Gilbert Sanga. And the one who is going to explain our chapel project is Sister Devota Msigwa. You are welcome.
I am Father Dr. Gilbert Sanga, the priest of the Catholic Archdiocese of Mbeya. I'm a doctor, Masters of Medicine in General Surgery. Generally, I'm a general surgery. I've been working here in Mwanbani Hospital for 3 years as a surgeon. And also in the Mwanbani Hospital, I am a medical officer in charge. Here, Mwanbani Hospital, it has 50 years ago, where it was being founded by the St. Franciscan sisters from Netherlands, was being championed by Sister Tarsis, who initiated this hospital, and also the early services was done those 50 years ago. Since the hospital has been stayed for 50 years, so many things have been changed. Even the building also have been changed, and also the number of people who are taken care by the hospital have been increased. So the hospital now is in need of many things. Since I've come here, we have tried a very big thing to improve the hospital. First, to do some sort of renovation of the buildings, also to improve the number of staffs in the hospital, also services. Since I'm a general surgery, here at Mwanbani Hospital, we have improved a lot surgical cases. For example, I'm doing orthopedic surgeries, I'm doing laparotomies, I'm doing hernias, also maternal cases such as cesarean section and complication dealing with the cesarean section. The big thing enough here now in Mwanbani Hospital, we have a specialist of the obstetric and gynecology, who is called Sister Hilda. Also is a doctor who is taking care of mother and neonatal babies. So by description, Mwanbani Hospital has a lot of services apart from surgical cases. Also we have dealing with the dental. Also we are taking care for the patient with HIV, CTC. Also we have also a part which is dealing with the children clinic, RCH. Also we are admitting patients here in various wards. In this project, we concentrate on the matters of children and the pregnant mothers and all process of deliveries and also complications. Mostly based on the first ward, we called here Ward 1, whereby we have only one ward which is dealing with the mothers, pregnant mothers, the ward which is dealing with the deliveries, labors, and also caring of the newborn. By just description or describing this ward 1, the first part is ICU, intensive neonatal unit, whereby the baby who are delivered by the complications may be prematurity. They are being born before 9 months, so they need intensive care. We have the first room, which can accommodate only 2 babies, but in need 3 babies can stay there, but there is a very big risk of infection. But normally we need only 2 babies to be taken care in intensive care unit of neonat. Also, there is another room which is has 3 beds. This room is used for the post-operative patients, the patients who have been operated by cesarean sections, and also the patients who have been operated due some complications during deliveries. So we have another room which has only 3 beds. Also, we have another room whereby it accommodates patients who have been have gone normal delivery, SVD, spontaneous vaginal delivery mothers. So they can just stay here in the ward for 24 hours or 48 hours. This ward useful for the observations after delivery. We observe the patient, the mothers, and also their baby for any complication which they can occur. So this accommodates 10 beds for taking care for the mothers who have been normal delivery together with their babies. And also we have another room which is for the waiting mothers, the mothers which labor is about to start. These mothers can remain in another room which also accommodates 5 beds. So it has only 5 bed capacity. This is the area of the mothers. And also we have another part, this is the most important part in this ward, which is called labor ward, labor room. The labor room also has 3 beds, whereby the mothers who are in labor, active labor, are taking care in that rooms. So that is a short description of the our ward, our building, which is useful for the pregnant mothers, delivery, and taking care for the new babies. So by just seeing the situation by itself, we can find out the hospital has a lot of patients in comparing to the building. For example, cesarean section, at least every day we do 1 cesarean section. Per month we have 40 cases for cesarean section per month. About normal delivery, per day at least 8 normal delivery per day, 8 normal delivery. So approximately per month we have 400 deliveries. So per month in our hostel we receive new baby 400. So that is a significant number. It needs a lot of care. In just comparing to our buildings and our accommodations, it is insufficient. That's why sometimes you can find the patients, the pregnant mothers, are more than 5. So 1 bed can have 2 pregnant mothers, waiting waiting for the labor to start. And also you can find others at the floor. We just make the mattress at the floor where they sleep. But waiting mothers and also mothers post spontaneous vaginal delivery, also they stay 2 mothers in 1 bed. Others they stay at the mattress at the floor. So that it makes us have a very big need for the new big building. First of all, there is a risk of infections. Once the pregnant mothers, they stay together, others post-op patients others with their babies. So there are risks of babies to get infections for the babies, and also risk for the mothers to post-op mothers, post-cesarean section, also to get sepsis. So by seeing this, in order to reduce the maternal death, and in order to reduce the neonatal death, which is secondary to contaminations, secondary to infections, and secondary to neonatal birth asphyxia, and other cases which can cause complicated to the pregnant mothers and to the neonate, that the hospital has decided to have a very big building taking care for the neonate, taking care for the pregnant mother, and also the delivery. This new building is the area here where I am. We have already started the bricks. A lot of bricks here have been made here, and also we have the foundation of the new building. This building, the first part will be reception. This reception will be useful for the any patient, a pregnant mother, or with a baby, or any patient who is coming here, but get needs for taking care, is being received by the nurses and by the doctors, and the doctors will decide where to go. So there is a first part for reception, the doctors' offices, and also from there we shall have a place whereby a waiting mother, a mother whose labor has not started, so is just waiting. There is a ward. The mother is monitored whereby the progress of his labor or her labor. After the labor has been initiated, once the labor has been initiated, so the decision must already been made, or sometimes can be made later on. So the patient can be sent to the labor room. So we have also the labor rooms where we have 5 beds for the accommodation for normal delivery. So if the patient needs normal delivery, will be sent to that rooms for normal delivery. But if there is complications or the patient needs cesarean section, also we have a theater which has 3 operating rooms. So if the patient needs some sort of operations, we'll go there and will be taken care of that areas. So from there also we have another ward. In the same building, we have another ward which will be taking care for the patients who have been operated by cesarean section. So post-op areas, there is a room. And also there is another room for the mothers who have been delivered by vaginal, normal delivery. So as I have said previously, that they will stay just for 24 hours or sometimes for 48 hours just for observation. So for any complication which will happen immediately after delivery, or 24 hours or 48 hours after delivery. So there is another rooms which has a significant number of beds and also a space. Also from there, also we have another ward whereby we'll be taking for the patients, newly baby, with their complications. If they are being born, they are sick. If they are sick, so they will have a special ward whereby the mothers will be going there to the specific baby for breastfeeding, and the doctor will continue with nurses for nursing care in that ward. Also, the same building will have a station, nurses' office, whereby all documents for the nurses, for the computers will be there, and also other areas whereby the hospital will accommodate. So this building will have a significant number of areas to stay, and then will accommodate and will solve many problems concerning newly delivery. If the pregnant mother at labor, there are more than 3, so since we shall have 5 delivery beds, so will be accommodated rather than what we have here now. We have only 3. If the mother are in labor more than 3, so sometimes it becomes very much difficult, and they can go to another place for delivery. That is very much risk for complication during delivery. So all this plan, the hospital has seen these problems. That's why we have decided to make this building. But this hostel, most of the patients who are coming here to get services are very much poor. They don't have money. So that's why most of them, we are just taking care of them without any payment. And they also to get the strength to build here, this building, we lack short of money. That's why we have made only these bricks and also these short foundations. So in order to complete our project, we need benefactors to help us in order to achieve our goals, in order to achieve our wishes. As we know, this country of Tanzania, with our President Dr. Samia Suluhu Hassan, is much aware and is very much helpful for taking care of the mothers, to reduce the cases of maternal death and also neonatal death. So we humbly ask the benefactors to help us for our important project. Thank you a lot.